This is a demonstration of the Sandlot Connect Health Information Exchange. Sandlot Connect is the healthcare technology infrastructure that enables patient data management for truly coordinated care across caregivers and settings. Developed by physicians, Sandlot Connect aggregates and sorts clinical and claims information to present a comprehensive medical record, including medication lists, diagnoses, allergies, transcripts, labs, etc., to the provider at the point of care. Let's review Sandlot's SaaS-based clinical portal to learn more about the power and effectiveness of an integrated health information exchange. When a care provider logs into the secure site using their unique login credentials, they are taken to the home page. The home page provides access to patient lists, notifications, and the message inbox, which allows for secure, HIPAA-compliant communication between providers. In addition to physicians, users of the portal may include physician extenders, care managers, and support staff, all of whom are supported by Sandlot Connect via role-based access and user preferences. The scorecard allows users to track quality measures and gaps in care for their patient population, including 5-star, ACO, HEDIS, and PQRI measures. In addition, our Measure Builder tool allows clients to create custom measures for managing their patients. Providers can select a comparison population to see how they're performing compared to providers across an entity, providers within their practice on average, or to a benchmark. The user can click on a measure to view the patient list. The list provides the names of patients who require action on the given measure. From this drill-down view, we can also view the total number of measures for which a patient is requiring action, enabling efficient outreach to accomplish quality goals. To view a patient record, the user may select a recent patient, a bookmark or favorite patient, or search for patients using the simple or the advanced search option. The user's role will determine which search criteria are required, as Sandlot supports broad, narrow, and MRN search roles. From the search results screen, users can verify demographics to ensure they select the correct patient. Sandlot supports the flexibility of showing all patients matching the criteria entered, or displaying only the patients to which the user would have access given their role and the patient's consent granted. This may vary by regional regulations or organizational preferences. When the patient is selected, the user will be taken to the patient record. Sandlot Connect will again ensure that the user can access only the information to which they are allowed based on role and patient consent, and supports break-the-glass access via the Extended Access Rights feature, which can be enabled or disabled. From the summary view, the user can review demographic and insurance information in the header bar, as well as click through the tabs or data elements in the summary sections to review health information on the selected patient. The patient record includes information from across a community, including physician practices, hospitals, laboratories, radiology groups, ancillary providers, and claims data. Because Sandlot offers true bidirectional interoperability, physicians can view the information available from the health exchange right in their EMR. This access to real-time data via a community-based continuity of care document delivered into the clinical workflow contributes to a better understanding of the patient's health and improved coordination of care. The episodic continuity of care documents, or CCDs, within Sandlot Connect provide a summary of the discrete data that was captured from the point of care via providers' EMRs. We can review medications documented, for example, and see that the data is not only included in the clinical document, but the information has also parsed out to the appropriate section of the community record. This allows for a patient record that is dynamic and reflective of the real-time information as it is received, and can be accessed whenever and wherever the patient is seen. The Documents section allows users to quickly review available reports and notes. Documents can be grouped, filtered, printed, or emailed to another user. Providers who are not connected to the exchange via an interface can also upload care documents via the Add Document button. Users can select pre-configured document profiles for standardized uploads, or proceed without a profile, attach their document, and select the relevant metadata for their document. This will immediately add the document to the patient record and will be visible for providers with the appropriate permissions. This feature enables community providers who do not have an EMR or the technology infrastructure to support a live feed to still be able to share care documents with the community. The Labs tab allows users to review results available from participating laboratories and quickly identify abnormal values in the record. Selecting a test name will generate a longitudinal table view of labs to allow for trending results over time, including abnormal range flags and the source name. Clicking the Graph tab provides a graphical view of the results, which also represents the range and abnormal values. Patients may be bookmarked from several screens within the portal, allowing users to build a favorite patients list for quick reference and to set notification preferences for that patient. Notifications can be customized per patient to ensure that users receive only timely, relevant updates for their role in the patient's care. The user can select both the information for which they want to be notified as well as the time interval for notification. Providers can also select the theme of their portal view, update their email address for notifications, and access the Help menu from the User button. To demonstrate the power of Sandlot's community record, let's consider an actual patient scenario. Mr. William Faulkner reported to a local emergency room complaining of fatigue, shortness of breath on exertion, and left arm numbness. He was in significant distress and unable to provide details of his medical history. The ER physician logged into Sandlot Connect and within seconds was able to determine that Mr. Faulkner had diagnoses including chronic congestive heart failure, chronic obstructive pulmonary disease, renal insufficiency, depression, and early dementia. Informed with an up-to-date record of his problems, the physician asked Mr. Faulkner about his activities leading up to his worsening symptoms. He described working in extreme heat the day prior and developing some nausea and diarrhea afterward. When asked for a list of his other providers and current medications, Mr. Faulkner could only remember that he was using inhalers and taking a water pill and something for his heart. On further review of Sandlot Connect, the ER physician found a comprehensive medication list, including furosemide, metoprolol, as well as Advair and Brovana inhalers. Mr. Faulkner reported that he had continued his water pill despite his diarrhea and other symptoms. A clear chest X-ray and elevated creatinine and BUN levels in the ER were compared to previous chest X-rays and laboratory results readily available within Sandlot Connect. These findings were consistent with acute and chronic renal insufficiency secondary to heat exhaustion. Mr. Faulkner was admitted for stabilization and scheduled to follow up with his PCP and cardiologist, who were identified in Sandlot Connect, allowing smooth transition and coordination of care. Having access to Mr. Faulkner's record in Sandlot Connect allowed our physician to respond quickly with the information necessary to make a correct diagnosis and appropriate management decisions. This prevented a prolonged hospitalization, as well as unnecessary and redundant tests and further workup. Mr. Faulkner was efficiently transitioned to care with his PCP and specialists, all of whom have access to the information from the ER, hospital, and discharge summary for continuity of care to keep Mr. Faulkner happy and healthy. This concludes the demonstration of the Sandlot Connect Health Information Exchange.